Good morning, dear colleagues. I would like to thank the Global Power of Oncology nursing team for allowing me to present, and I would like to thank you all for being present here today. My name is Shenila Anwarali, and I'm a pediatric oncology nurse from Pakistan. The title of my presentation is Prevalence of Stress and Stressors Among Pediatric Oncology Nurses Working in Pediatric Oncology Units in Pakistan. Pakistan, with over 240 million people, includes 104 million children under the age of 18. As of 2023, 37.2% of the population lives in poverty. The country faces a critical healthcare challenge with fewer nurses than doctors, impacting the quality of care, especially for its large child population. Each year, around 400,000 children are diagnosed with cancer globally. Of these, approximately 10,000 to 12,000 cases occur annually in Pakistan. Given the large number of pediatric oncology patients in the lower and middle income countries with a limited number of specialized nurses, it is critical to provide a supportive work environment that enhances job satisfaction and preserves the psychological health of the nurses. The State of World Health Nursing Report 2020 highlights the global shortage of nursing workforce estimated at 5.9 million nurses, with 89% of this shortage being in lower and middle income countries. Pediatric oncology is a highly stressful work environment. The stress nurses face affects their well being and the care that they provide. Key sources of stress include the challenging nature of their work, heavy workload, and emotional strains from losing their patients. These factors contribute to high stress levels and need to be addressed to support both the nurses and patient care. The list of 14 hospitals that treat pediatric oncology across Pakistan. It is easy to see the distance many patients and family have to travel for their treatment. With this, we came up with two critical research questions for the study. What is the stress level of nurses working in pediatric oncology units in Pakistan? And what are the stressors among pediatric oncology nurses in Pakistan? For this, an analytical cross-sectional study was used to assess stress levels among pediatric oncology nurses in Pakistan. The study included 150 registered nurses from 15 hospitals. The research was conducted in various hospital settings to understand stress and stressors across different environments. For this, we collected data using a questionnaire that included 13 demographic questions. To assess the level of stress among pediatric oncology nurses, we employed perceived stress scale tool. And to measure job-related stressor, we used the stressor scale for pediatric oncology nurses, which is further divided into 6 subcategories, as mentioned in the pink box. Each of these subcategories have different line items to assess the nature of the stressors. For this study, an ethical review was obtained from Aga Khan University Hospital, which was followed by an anonymous online questionnaire distributed in collaboration with Pakistan Society of Pediatric Oncology to 150 nurses across 15 pediatric oncology units. 5 reminders were sent to encourage participation. The survey was closed in September 2023. With this, we come to the results. We obtained a 72% response rate. Most of the nurses were between 21 to 30 years, were female, and were married. On average, nurses had around 8 years of overall experience with approximately 5.7 years in pediatric oncology, and majority reported receiving specialized training in the field of pediatric oncology. Most of the nurses worked in private hospitals and had completed post-RN BSc in nursing. 85% of the nurses worked at bedside and in inpatient areas. So we will now discuss the results of stress and stressors using the tools. Perceived stress scale results showed that a large portion of nurses were moderately stressed, along with 13% being severely stressed. While looking at demographic association with stress, the results showed that male and female nurses in Pakistan experienced stress differently. With the perceived stress scale, men may feel higher general stress considering the societal pressure and then the field that they work in. While women may feel more stressed from the specific tasks in pediatric oncology. This means we should think about different types of supports to help nurses manage their unique stress and provide best care for the patients with cancer. The stressor scale for pediatric oncology nursing revealed the highest average score was knowing what is ahead. This category reflects the emotional challenges nurses faced when they anticipate what lies ahead for their young patients and their families. Furthermore, there was only association between the type of hospital and specialized areas. Nurses working in government and armed force hospitals were more stressed as compared to nurses working in private hospitals. Additionally, nurses in inpatient units and emergency room felt more stressed than those working in outpatient and daycare areas. This suggests that certain types of hospital and work settings may require extra support to help nurses manage stress and cope with stressors. The important finding from this study was that cultural views shape how stress is experienced in caring for pediatric oncology patients. The emotional burden of caring for terminally ill children can differ based on cultural beliefs. In Pakistan, these cultural factors influence how nurses perceive and handle their stress. The following strengths was that this study established a baseline data on stress and stressors among pediatric oncology nurses. There was a diverse representation from various regions and types of hospitals, enhancing the generalizability. And two validated tools were used. The limitation includes relying on self reported measures like perceived stress scale and stressor scale for pediatric oncology nursing, introducing a potential response bias. Furthermore, stress and stressors were assessed at a single point in time. From this study, the recommendations for practice was to support our pediatric oncology nurses. We should implement employee assistance programs and counseling services to help them manage their stress. Regular screenings for stress upon induction and at intervals can identify challenges early on. We need to foster open communication and peer support among nurses, encouraging them to seek help from colleagues and counselors. Finally, promoting collaboration between physicians and nurses will strengthen teamwork and reduce stress. In regards to research, we need to better understand nurses' experience with stress. For that, we can conduct qualitative research through interviews and focus groups. This will help us gain deeper insight into their challenges. We can also investigate cultural factors in Pakistan to create tailored interventions. Additionally, longitudinal studies to track stress levels over time and a use of mixed method approach to explore perceptions of stress and its various stressors can also be conducted. Pakistani nurses caring for children with cancer reported experiencing moderate to severe stress overall. The similar stress levels across different respondents emphasize the significance of each stressor in pediatric oncology nursing in Pakistan. Notably, female nurses, those working in government hospitals, and those in inpatient and emergency units reported a higher level of stress. To address these challenges, we recommend implementing employee assessment programs, providing counseling services, and enhancing collaborative care among the healthcare team. Thank you for listening patiently, and these are the references.